When I first got to CAMC, one of the things that struck me the most was how close everyone is. Like, all the different hierarchical levels are very close to each other. And there's also a very nurturing environment where my voice comes across, your voice comes across, my ideas come across. And so that's one thing that was also a very big landmark in my residency, is how much I was able to work closely with the GME office and the administrative level on different projects. I really loved living in Charleston. A lot of people think, oh, West Virginia, what are you going to do in West Virginia? You came all the way from Lebanon, how did you end up in West Virginia? That's been a common question for me. And honestly, for me, I loved living in Charleston. I almost took a job in Charleston, which I didn't for many reasons related to my career and stuff, but I loved living here. It was such an easy place to live in, especially during residency. You don't want to wake up and have to scramble for an hour to get to work. The fact that I woke up and I could get to work within 10 minutes, sometimes even less, because I lived in Mirror Village the second half of my residency, that for me was great. And just even living in Mirror Village, which is CAMC housing, that was amazing. Having the river in my backyard and having so many activities that I could do. You don't get that in big cities. You're either living in a little tuna can sized apartment, or you're going through the motions of living in a city, the stresses of living in a city, those kind of things, which Charleston has all the amenities of a city, but then it has all the comforts of living in a small place as well. When I first joined, I had a lot of interests. I wanted to do research on meditation. How can you apply meditation in healthcare? And that took me on a roller coaster ride of amazing blessings that happened along the way. And the reason that all of those things happened was because I was in a program that was so open. It was so open for new ideas, new initiatives, and it was very supportive of those new ideas and initiatives. And I found myself not just supported by my program director, but also supported by the GME office and the administration to kind of make all these ideas happen. So other than the fact that I practiced, classical family practice, the range of conditions and age groups, I also got to run a stress reduction clinic, which basically helped me to do talk therapy with my patients that was centered around a program called the Mindfulness-Based Stress Reduction Program, which basically delivers meditation and mindfulness to people and how they could apply this in their daily lives to actually help them live with their conditions and hopefully heal from their conditions as well. And so that also morphed into a well-being curriculum in our program, which was administered to all the residents. And then because we are at a time right now where burnout is a key word in the ACGME world, our program was used as a model to deliver forms of this curriculum to all the other residency programs. Because of course you can't do a copy-paste program for a family practice resident than for a surgery resident. You're going to have to kind of tweak it a little bit. But over the course of my residency, we went from a possible research about meditation to these well-being curriculums that are now on everybody's tongue in CAMC, which I attribute to the leadership. The leadership pushed for well-being to become something that is important in every program, and that's what happened. So in my residency, I was able to create a program for us, and then I was involved in creating an educational program with the GME office that was delivered to all these residency programs. And now everybody is talking about well-being and how can we improve well-being in our programs. And so, I worked with my patients on these kind of initiatives, and then I worked with residents on these kind of initiatives. And now, moving forward in my new job, I'm going to also be starting a stress reduction clinic where I'm going to be helping them develop a well-being curriculum as well for their employees. The patients that we cater to here, they're a sicker population than the rest of the US. So in many ways, the education that you're receiving as a doctor is a little bit more intense, which provides you're armed better by the time you end with this residency. One thing that I realized, when we were doing our well-being curriculum and those kind of things, we got the opportunity to travel around and do some national conferences as well, present our work and talk about our results and what we've been doing. And that allowed me to talk with other residents and other program directors about their programs and what they're doing and that kind of stuff. And I realized, like, for us being in West Virginia, it's a norm for a patient to come in being on like 30 medications, having like 5 different health conditions, the minimum, right? And like having gone through so much of their history, like surgeries and such a complicated history, and that became a norm for me. So now when a patient comes in and, you know, they have all these complicated issues that I need to be aware of, it's very easy for me to understand what I need to do with this patient and how to move forward, how to build rapport with this patient. And I really feel like you don't get that unless you're dealing with a very sick population. And I mean, obviously it's a good thing and a bad thing at the same time. You don't want your populations to be so sick, but at the same time, you know, what doesn't kill you makes you stronger, you know. So I feel like I'm a better armed physician because I trained in Charleston. And when I compare myself to residents that I met in other areas, you know, when I told them about my experience and what it's like to be in Charleston, a lot of them felt a little bit flustered by that. Like, oh, how did you do this? How did you deal with a patient that had this and that? You know, and for me, that made me, you know, proud of my abilities as a doctor. But also I feel like working in West Virginia it makes you stay true to why you are being a doctor, right? You want to work with patients like this. You want to help patients like this become better. You want to feel like you came to a place and you left a mark. And if, you know, being in Charleston allows you to do that very well. My favorite thing about the family practice program here was probably the administration, the leadership. I think from the chairperson to the program director to my attendings, my supervisors, like everybody was so easy to talk to. I felt like I made friendships during my residency. I didn't feel like this person's just the chairperson or this person's just the program director. I felt like they were also my friends. In many ways, I also felt like they were family. Like my program director, you can call him up and you can say, where do I get a good haircut? You know what I mean? Which is like in other places in America, it might be more difficult to have that kind of, you know, relationship with a program, especially bigger places where there's like, you know, 40 residents or 50 residents, you know. Our chairperson, same thing. I think he's one of the funniest people I've ever met in my life. And it was so easy to not just talk to him about, you know, like the funny stuff and kind of laugh and stuff, but also the serious stuff, you know, like how do I deal with this patient? How did I do when I dealt with this patient? What can I do better? You know, it was always constructive feedback, always. Even when it was negative, it was constructive, which I appreciated a lot. You know, it's really hard to receive negative feedback. And when the person in front of you is like intending for that feedback to cause growth, you know, it's a much different, it lands on you much differently. And so that's one thing that I appreciated a lot in our program. My favorite thing about the program was obviously my ability to do everything I wanted to do and how much growth I achieved from being able to practice medicine the way I wanted to practice it, which I don't feel that, you know, most places are open to you coming in and saying, well, I want to teach my patients how to meditate. I think if you teach a patient how to meditate, they'll do better with their diabetes, they'll do better with their blood pressure, they'll do better with their depression, you know, and in many places they're going to go, well, what's the evidence behind that? You know, and there's a lot of evidence behind what I do and what I've done in my residency, but sometimes people like to stick to the classic manuscript of how to run a certain practice, you know. And for me, our residency was so open, and I'm not the only one that can tell you that about their residency. Other residents will also tell you that with what they've done. And in the 3 years that I've been in my residency, it's been a different residency every year, because every year new people came in, new ideas came in, new collaborations happened, new initiatives rolled out, and it was just great watching the residency change that way. I didn't just learn to be a family doctor, I also learned to be a good human, you know, a good teammate. I learned how to roll out initiatives in a very like project management type of way, because I got to work so closely with the GME office. I think what they do is great, and how they kind of bring people together, and it's not always easy to bring a bunch of doctors together. We all have big personalities and we're all busy and we all think what we're doing is more important than everything else. So, you know, they always brought us together, they always made us work together, and it was always really good outcomes that came out of those collaborations. So I learned so much, you know, and I think for anyone who's kind of feeling a little bit hesitant about coming to CAMC, or feeling like, oh, you know, West Virginia, what am I going to do in West Virginia? I think like cast all that aside, come here. You know, I learned a lot. Everybody around me that I had the experience to work with learned a lot too. And I really think people should come here feeling grateful, feeling blessed that they were able to join such a community.